Hannah. I'm going to be your nurse today. What's your name?
Matthew.
And how old are you, Matthew?
29.
All right, well, today you're in for just a respiratory assessment. It's going to be a lot of looking, listening, feeling. Doesn't mean anything's wrong. We're just going to do a thorough exam. Are you ready to begin?
Yeah.
All right, first thing we're going to do is make sure that your anterior and your posterior is 1 to 2. This just looks at the shape and configuration of your chest. All right, if you can go ahead and turn this way for me. I'm just going to have you turn to the side so we can verify that. Anterior, posterior, 1 to 2. Perfect. All right, if you want to face this way. All right, next we're going to just make sure that your scapula and your spine are in alignment. All right, and now we're going to check for tenderness. Okay, I'm just going to be pressing. Let me know if you feel any tenderness. Do you feel any tenderness?
No.
All right, we're going to do the same thing. I'm going to put my hands in the same spot, and I want you to say 99 every time you feel my hands touch. I'm just feeling for some vibration. This is called tactile thermitis. Okay, you ready?
99, 99, 99, 99.
All right, perfect. All right, now we're going to do some percussing. Okay, I'm just going to be tapping on some of your lung fields. Okay, ready? All right, perfect. Now I'm just going to be listening in those same spots, okay? I want you to roll your shoulders forward. And when you feel my stethoscope place, I just want you to take a deeper breath through your mouth, as a little bit deeper than normal breath through your mouth, okay? All right. All done with that. Now what I want you to do is let out all your air and then take a big deep breath in. All right, perfect. All right, you can go ahead and turn and face this wall behind us here. All right, now I'm just going to be looking at your chest, making sure you're not using any accessory muscles to breathe, making sure you're not having any labor breathing, making sure that everything's nice and symmetrical in your expansion. And it looks like your respiratory rate is within normal limits, okay? We're going to do the same thing we did in the back to the front, okay? I'm just going to place my hands. Tell me if you feel any tenderness, okay? All right, we're going to do the 99 next, okay?
99, 99, 99.
All right, now we're going to do some percussion, okay? Okay. Now we're just going to listen in those same spots, okay? Same thing. You don't have to roll your shoulders forward this time, but you're going to take a deeper breath through your mouth, okay? All right, Matthew, and that concludes our assessment today. Do you have any questions?
No.
All right, thank you. Today we did a respiratory assessment on a 29-year-old male. His spine was in alignment. His AP to T diameter was 1 to 2. His posterior and anterior thorax were negative for tenderness. Tactile thermitis was equal bilaterally. Resonance was the predominant sound, and he was clear to auscultation in all lobes. We checked symmetrical expansion posteriorly, and it was equal bilaterally. And his rate was 24, respiratory rate was 24 breaths per minute, and he had no use of accessory muscles.